Alberta, we have a challenge, and it's not just our COVID-19 numbers. We are increasingly challenged by polarizing narratives that on the one hand say we need to drive to zero cases at all costs, and on the other hand say that COVID is a mild illness for most, so we should let it spread freely and pursue herd immunity. We are not well served by false dichotomies or by any positions that make it harder to have the respectful dialogue that a complex, wicked problem like COVID-19 presents. We must continue listening to each other and striking a difficult but necessary balance. We cannot live in fear and terror of COVID-19 for months to come. Yet we also cannot abandon our efforts to protect the most vulnerable members of our communities and to make sure the health system can continue meeting all Albertans' health needs. I don't ask that you fear COVID-19, but that you respect it. COVID is a novel disease that is not just the flu. It has the ability to overwhelm our health system and weaken essential services if we let it do so. Respecting COVID-19 means taking public health advice seriously and taking care of not only ourselves, but also our communities by preventing transmission. The trigger of COVID hospitalization growth that we have been watching is not above 5%. However, we need to respond to the actual situation, not just the metric chosen in the spring. This weekend's COVID-19 numbers tell the story clearly. We identified on average 480 cases of COVID-19 per day over the weekend. Breaking it down by day, on Friday, 364 new cases were identified, while our lab conducted more than 16,000 tests. On Saturday, we completed over 17,000 tests. We also identified 572 new cases. And yesterday, we diagnosed 504 cases and completed almost 12,700 tests. There are currently 118 people in hospital in Alberta, including 16 in intensive care with COVID-19. One of the challenges of rising cases is that it creates pressure on certain key elements of our COVID-19 response, including contact tracing. We have been working with AHS on new strategies to more effectively and efficiently notify close contacts of confirmed cases of COVID-19. Right now, AHS has more than 800 staff on its contact tracing team. AHS is increasing their staffing as quickly as possible, and they are actively recruiting more people to meet these increasing demands. But we still need to get information to Albertans faster. Effective today, if a positive case attended an event while infectious, AHS will now notify the organizer and provide them with written notification that can be directly emailed to all event attendees. We will be asking event organizers to send these emails within 24 hours of being contacted by AHS. This change will make the close contact notification process quicker for large events. Of course, if an event organizer cannot support this more rapid email notification process, AHS will continue to make these phone calls. AHS will also continue to directly notify close contacts of cases who were exposed outside of any public or private event, and will continue to directly contact anyone who tests positive for COVID-19. Turning to schools, there are active alerts or outbreaks in about 11% of schools, with a total of 680 active cases. There are currently 101 schools with an outbreak, including 39 that are on the watch list, with 5 or more cases. 39 schools have now been removed from the outbreak list as their outbreaks have ended. Parents, teachers, students, and staff are taking their responsibility to protect one another from COVID-19 seriously, and I thank them for their dedicated efforts. So far, in-school transmission has occurred in 79 schools. Of these, 45 have had only one new case result. These are significant numbers, but it is important to keep them in context. Just 6% of all COVID cases in those aged 5 to 19 since September 1st have been acquired at school. This shows that schools are not a main driver of community transmission, but that our rising community transmission is resulting in more school exposures. This reinforces the importance of addressing the rising spread we're seeing in our communities. Sadly, I must report 7 additional deaths of COVID-19. This is a heartbreaking number. My thoughts go out to those families and everyone else who's grieving right now losses of any kind. In Edmonton specifically, while the rate of growth in new COVID cases had declined to 1.13 after voluntary measures were announced on October 8th, that has risen in recent days and the number of cases continues to grow. The average positivity rate for all COVID-19 tests in Edmonton has now increased to over 4%. Hospitalizations of COVID-19 patients and the other impacts of increased community spread have started to impact other services. As I mentioned earlier, due to the demands on the health system, AHS has moved to postpone up to 30% of non-urgent surgeries in the Edmonton zone. This measure will need to remain in place until the COVID-19 demands ease in order to support safe patient care in hospitals in the area. In the last 2 weeks in Edmonton and Calgary, social gatherings made up just 15% of all outbreaks, but almost a third of all outbreak-related cases. Workplace outbreaks made up about 15% of outbreaks and outbreak cases. In contrast, there has only been 1 outbreak linked to a restaurant in the past 2 weeks, and less than 1% of active cases in Edmonton and Calgary are linked to exposures in restaurants. Today, I am announcing new public health measures for the cities of Edmonton and Calgary to help prevent the spread of COVID-19. Effective immediately, we are implementing a mandatory 15-person limit on all social gatherings in Edmonton and Calgary. This limit applies to gatherings where people are mixing and mingling, such as dinner parties, birthday parties, social events, and wedding and funeral receptions. It also applies to special event celebrations like retirement events, baby showers, and other social gatherings. This limit does not change the measures currently in place for events that are structured, such as ordinary dining in restaurants, theaters, worship services, or wedding and funeral ceremonies. However, it would apply to gatherings that may occur before or after these events, such as wedding receptions or a social event at a restaurant or another site. We are following the evidence and implementing a targeted measure that will help reduce transmission and limit the risks of cases growing exponentially in both cities. These social gatherings tend to be less structured and can struggle to implement key measures like physical distancing and hand washing to reduce the risks of exposure. This 15-person limit is temporary. It will be reassessed after 1 month and can be lifted if we see our growth rate, or R value, decline below 1 and new case numbers consistently below 100 in each city. The measures are not being taken lightly, and I know they will impact many, but they are necessary to prevent the spread of COVID-19 from continuing to escalate. AHS will also be increasing inspections of public-serving businesses to ensure that existing guidance is being followed and customers are protected. Due to COVID-19's incubation period, it will likely be 1 to 2 weeks before we can begin assessing the impact of these health measures. We will be watching our numbers closely to assess the trends. But the impact of public health measures alone cannot compare to the collective power of all Albertans taking action.